Rubber dams can be a huge benefit to operative dentistry. A properly placed rubber dam will help to maintain a clean, dry operating field, improve access and visibility of the area to be worked on, and protect both the patient and the dentist. A rubber dam is almost always indicated in restorative dentistry unless the patient has difficulty breathing or cannot tolerate the dam. Rubber dams are especially important when restoring with composite, as the area needs to remain free from excess moisture. Rubber dams come in both latex and non-latex varieties. The items you will need to place a rubber dam include proper PPE, the rubber dam stamped with an outline of the dentition, rubber dam frame, a clamp, forceps, hole punch, scissors, a paddle instrument, and floss. You may also need a water-soluble lubricant to aid in dam placement between tight contacts. To place a rubber dam, attach the frame so that the open portion will face superiorly on the patient and that the curve of the lower bar will follow the curve of the patient's chin. Punch the holes in the dam. For molars, use the largest hole punch, moving to smaller holes for premolars and anterior teeth. Remember to isolate a minimum of 5 teeth. Next, select a clamp. Whichever clamp you choose should be tied with dental floss to prevent aspiration or swallowing in the event it is dropped. There are many different types of clamps for different teeth. It is important to select a clamp which will contact the tooth on all 4 line angles. This will prevent it from rocking or tilting, which can damage the tooth and gingiva of the patient. Clamps can be either winged or wingless. If you are using a winged clamp, place it in the most posterior hole of the dam so that the bow will face distally when placed in the mouth. Insert the forceps in the holes in the clamp and carefully place the clamp around the desired tooth. Be careful not to damage the gingiva or the tooth. Ensure the clamp is secure before moving on, and slide the dam off the wing of the clamp underneath to the tooth. The only difference in placing a wingless clamp is that the clamp is placed on the tooth without the rubber dam in place. Then the dam is stretched over the clamp. Pass the rest of the teeth to be isolated through their corresponding holes. If the dam does not immediately pass through the contacts, use floss to gently slide it through. Once the dam is placed around the teeth to be isolated, you may want to place some floss or a rubber retainer through the most anterior contact to help the dam stay in place. Loop the floss on the clamp around the frame as an added safety measure. Inverting the dam around the teeth will be an important step to ensure proper isolation. Use a paddle instrument to gently push the dam around each gingival sulcus. Once your dam is placed, examine it to ensure there are no areas of gingiva showing through. To remove the rubber dam, remove the anterior retainer from the contact area. Remove the clamp with the forceps. Stretch the dam facially and carefully cut each septa with scissors and gently pull the rubber dam out of the patient's mouth. Make sure to double check interproximal areas for any pieces of rubber dam that may have gotten stuck.